Hello and welcome to my short presentation about the importance of understanding and managing emotional well-being when managing chronic pain. I'm founder of Canine Arthritis Management. It's an online resource for owners and professionals to best manage a very common and crippling disease, osteoarthritis. Osteoarthritis is now considered a welfare concern. It is highly prevalent. It affects the dog's life for a long period of time and causes huge amounts of suffering. Canine Arthritis Management challenges how we best manage, from identification, diagnosis, through to management. So please do go and check out our resources. So I am a veterinarian and I've been a veterinarian for 21 years now. I'm a small animal veterinarian. I've been working in clinical practice. I've worked in a variety of roles, but my interest in chronic pain management started around about 10 years ago. And since then it's become more of an obsession. I've realised over those 10 years there is so much we can do to better manage musculoskeletal chronic pain and other chronic pain conditions. So please do go and check out the Canine Arthritis Management resources. We have an excellent team of advisors, 20 experts and specialists from around the world, covering all aspects of managing this chronic disease. Please do go and look at our resources and also know that there is a member zone which we would love you to join. But before I start, I'd like to take an opportunity to say a massive thank you to Pet Remedy for seeing the importance of this topic. The more that people understand about the importance of emotional well-being, the better for everybody. So high five Pet Remedy for having the belief and the ability to make this happen. But let's first deal with a very, very important aspect of my talk. Animals feel pain. We know this. Physiological and behavioural observations show that animals experience the sensory aspect of pain, but also the unpleasant aversiveness and negative emotions attached to that experience. That is courtesy of the World Small Animal Veterinary Association. We also know that pain perception is influenced by numerous internal and external factors, including the social and physical environment. That really does encapsulate the fact that emotions have a massive role to play in pain perception. So emotional well-being has a huge role in any pain management plan. So what is pain? What do we mean by that? It's a really, really broad term. Well, what it is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. The inability to communicate, such as with our fur companions, does not negate the possibility that a human or a non-human animal experiences pain. Just because they can't verbalize their pain does not mean that they do not feel pain. And we have to be very, very aware of that. We are their advocates, and it is our duty of care to identify the signs of pain early, look for a diagnosis, why are they in pain, and then find the most evidence-based ways to manage that pain, to ensure that they have a good quality of life. An aspect of managing that pain is considering their emotional well-being. Let me explain. So we understand that pain is a very complex, multidimensional experience. It's an experience. What one person feels is not going to be the same as what another person feels. It's very individual. It's composed of both sensory and emotional components. Pain is not just about how it feels, it's how it makes you feel. If you were to be having a bad day, your car's broken down, it's raining and you've got caught in the rain and you're drenched, and as you walk into work you stub your toe, that experience is likely to be a lot worse than stubbing your toe having just won the lottery. Pain itself is an experience composed of many different components to create that experience. The unpleasant feelings that come with that pain experience is what causes suffering, and that's what we normally associate with pain. But what do we mean by emotional well-being? It's quite a broad term, and there are many definitions. Emotional well-being, also known as emotional health, also known as emotional wellness, refers to how well an individual is able to accept and manage their emotions and cope with the challenges throughout life. Emotional well-being can affect how well or able you are to deal with challenges and change. Now, this is really well illustrated by something we quite often use, such as pain threshold. He's got a high pain tolerance. Has he? Or has that person just got greater capabilities of managing their pain? I know there are certain situations where we are not able to manage our own pain. Some days are good and some days are bad. And that certainly is likely to be influenced by your emotional well-being. Now, emotional well-being is not a standalone. Emotions do not sit separate to physical health. They're all highly interlinked, a web of connections. And we also know that your emotional well-being has the ability to affect your physical health. We've seen declines in the emotional well-being with people that are suffering from chronic diseases. So it's a two-way street. Emotional well-being can affect your physical health, and your physical health can affect your emotional well-being. So pain and emotional well-being, how can we illustrate it? And we can do it with a very obvious link, but there are many, many connections. A logical response to a painful event normally involves physical or potential physical harm, would be fear. You are fearful. It drives the behavioural changes to avoid harm or further harm, or having harm again. There is a fear associated to prevent you hurting yourself further. However, once that threat, once that trauma, once that incident passes, then the fear should subside. Fear is actually essential for life. The connection between pain and fear protects us from harm, enables us to survive. However, if pain persists, as in chronic pain, a fear-based response, which is there to protect us from harm in the future, allow healing, is replaced by anxiety. And anxiety is a feeling of being nervous, worrying about something that is happening or might happen in the future. It's a negative emotional state and potentially may not serve purpose. Now, this area is a rapidly changing field in the vet sector. However, there's huge amounts of work that we can translate from in the human sector. And we do know that humans in a positive emotional state are able to influence their pain perception. Now, that makes a lot of sense. I myself have a bad back. If I'm having a bad day and it's dragging on, the pain that I'm feeling in my back is likely to get me down. I'm likely to be a bit snappy. I'm likely to be a bit frustrated. I'll be in a negative emotional state, contributed with my pain and contributing to my pain. If I've been out surfing, if I've been out for drinks with my friends, I'm probably not going to recognize my pain. I'm distracted. I'm in a positive emotional state. It's not of great consequence to me at that time. So we can all relate to this. So translating this concept, which I've just illustrated, into caring for our pets that are in pain, comes actually with minimal risk. Yes, we've got a lot of work to do in this sector to really hammer home as many truths as we can, whether what animal experiences are the same as what us humans experience. However, translating it now comes with minimal risk and minimal cost, and it will also benefit you. Investing in creating a positive emotional state for our pets through interactions, handling, play, routines is going to benefit both parties, so should be invested in. So will we get to the point where we have clinical trials that show that animals in a positive emotional state have less requirement for pain relief with common conditions compared to animals that are in a negative emotional state, I think we're still a long way off from that. It's going to be a very hard clinical trial to actually compose. Can we translate from the human sector? Well, why not? There's minimal risk, there's minimal cost. It makes a lot of sense. It benefits both parties. So I'd like to highlight how you can consider your dog's emotional well-being throughout their arthritis journey. So before we explore the emotional well-being aspect of arthritis management, let's just review arthritis. Arthritis is a degenerative disease of the whole joint, and it creates something called inflammatory nociceptive related pain. Pain is actually our experience. The physiological process that drives that experience is called nociception. If this nociceptive related pain is not well managed, then it will amplify, and our pain experience will also amplify or get worse. The joints that are affected are painful, initially on use, and then that pain will persist through use or no use. And there will be an avoidance of using that painful joint or limb, leading to compensatory weight shifting and postural changes. This causes changes in those areas that are compensating, potential trauma, tissue damage, that then in themselves start signalling a pain experience. The pain experience expands. The dog's independent mobility to meet their daily needs is affected. Their ability to react to the changing environment is inhibited. Pain, especially consistent pain, affects emotional well-being and their behavioural responses. So the first aspect of the importance of emotional well-being consideration on managing a dog with arthritis surely is our identification. Noting that our pet's emotional well-being is affected, negatively affected, could be the first indicator of an underlying condition that requires us to investigate and best manage. Now, emotional well-being is also hugely important in the diagnostic procedure. To diagnose a chronic pain condition such as arthritis, we require observations from the owner, observations from the vet. We need to be able to perform a clinical assessment. We probably will follow up with imaging, diagnostic imaging. If we don't accommodate an animal's emotional needs and their emotional state, this can interfere with these necessary observations. It could affect our diagnostic procedures. We won't observe truth. We'll observe affected truth because of their affected state. We require accurate behavioural responses to alert us to pain, the area of pain. And for example, if a dog is in a negative emotional state, if they're in fear, if they're anxious, and they're in a clinic, there's no escape, they're scared of what's going to happen, they may well become stoic and not demonstrate where pain is. So it can really affect our diagnostic protocols. Now also, alongside this diagnostic procedure is the actual physical events. Imaging often requires a short stay in the vet clinic. There's also going to be veterinary assessments, where the dog has to come into the clinic, sit in the waiting room and go into the consult room. The dogs are going to be handled by people they don't know. They're likely to experience mildly invasive procedures. They may well spend times recovering in kennels, potentially alone, potentially scared. Multiples of these visits may be required. We must bring in emotionally considered adaptations to the plans so that these dogs are able to express themselves, and we certainly don't make the situation worse. Now, a concept that I work by, and I feel everybody should work by, when a dog or a cat arrives at that vet clinic, they may well be in pain. That's why the owner has brought them to see us. My aim is to make sure they go home in less pain. If I don't do that, I haven't done my job well. Part of that is ensuring that their emotional well-being whilst with me is catered for. There is a potential that their emotional well-being will influence their pain perception and their ongoing pain perception. Part of ensuring positive emotional well-being is going to be considered handling. So please take that into consideration when these pets are in the clinic environment. After diagnosis, there will be a management plan. This will be a long-term plan, a changing plan. This could potentially be 10, 12 years, as arthritis is actually a young dog disease. And during this period of time, there's going to be regular vet assessments, potentially giving pain medications, pain relieving therapies, rehabilitation related therapies. There's going to be changes to lifestyle and their exercise. There's going to be a lot of change. And having a positive emotional state, having good emotional health, is going to enable that dog to cope with these challenges and these changes. So incorporating activities that promote emotional well-being is likely to lead to long-term improved results. So I'd said previously, it is a developing field. It's an exciting field, but at present we often we use theory to come up with these changing conclusions. However, there are some studies that illustrate the concept. A study was done looking at training techniques on a group of dogs and its effect on their cognitive bias. And what was found is dogs that were enabled to do foraging tasks for their food had a more positive cognitive bias. They were more optimistic about the world around them compared to a group that were trained in heel work. So simple tasks such as foraging, scavenging, looking for food, hide and seek could actually promote a positive mental state. And we also know, for in the case of arthritis, movement and maintaining movement is absolutely key to support joint health and the related soft tissue structures. Another study was carried out looking at the impact of physiotherapy on what effect it had on the dog's psychological domain. And it was found that physiotherapy, which involves manual therapies, electrotherapies, lifestyle advice, weight control, house adaptations, actually had a very positive effect on the psychological domain of that dog within a quality of life scale measurement tool. Now, hopefully I've given you food for thought and you now realise implementing actions that promote emotional well-being is actually a very, very integral, important, sensible part of any multimodal management plan for chronic diseases such as arthritis. These implementations generally are very low cost and they will benefit you, the owner, the caregiver as well. So thank you for listening to me rabbit on about the importance of considering emotional well-being when managing chronic pain. I'm hoping that you are going to be excited and enthused and start thinking of how you can engage these understandings, maybe with your dog or the dogs that you care for. I'd like to invite you into the world of resources that Canine Arthritis Management have created. We also have a member zone, which I would really love you to join. Cam is now a beast. We have 20 expert and specialist advisors from around the world, creating incredible content for you, the people that need it. So I hope to see you in Canine Arthritis Management. I hope to see you in the member zone. Until then, take care.